Thank you, Mr. Chairman. Good to be with you, Secretary Kennedy. I hail from Philadelphia region, suburban Philadelphia. And I have to admit to you, this last round with Mr. Harder was relatively revealing that Maha, apparently, as you sit around the cabinet table, works only in silos. That's something you care desperately about. You have not had a conversation with the EPA. Secretary, that's rather
I have a lot of conversations with the
That was my
Secretary.
comment. Excuse me, that was my comment. Let me go to
It's just
MMR.
wrong what you said.
Thank you. Let me go to, let's talk about vaccines. Before the Trump administration came back into office and you came into office as Secretary, 2024, how many measles cases were there in the United States?
I think during the 4 years of...
No, I'm asking a specific year, the year before you came in.
I don't know, but very few.
Yes, you're right, 285.
Yeah.
How about in the first year of the Trump administration, 2025? How many cases of measles?
2,500.
You're very close. Yes, you're right. So we went from fewer than 300 to much more than 2,000. How about this year?
This year, 1,700.
This year, we're talking January to April the 9th,
1,700, yeah.
1,714. How many deaths have we had?
3 or 2.
3.
3.
2 children in Texas. You're aware of those. Yeah. And an adult in New Mexico, unvaccinated. Can you tell me, can you tell all of us, is the MMR vaccine safe and effective? Yes or no?
The MMR vaccine?
Yes or no?
Yes.
Thank you.
It's safe for most people.
Can you agree that getting the vaccine is a lot safer than getting measles?
Yes.
Terrific. That's why I am deeply troubled that vaccination rates are declining under your leadership, under this administration. MMR coverage has dropped to just 92.5%, well below the 95% threshold needed to prevent outbreaks such as we are seeing in this country like we have not seen in decades. Deaths that we have not seen in decades. Mr. Secretary, how many members of the Advisory Committee on Immunization Practices did you replace when you came in?
Well, I fired all 17 members.
That's correct. You fired all of them?
Yeah.
All of the vaccine board?
The entire corrupt vaccine board.
Okay, thanks. You've decided they were corrupt. And apparently what their practices were, what their recommendations were keeping us healthier, children healthier, children alive.
You're not going to let me reply. You will not let me reply because you do not dare to talk to me about what you just talked about, measles. You do not have the courage to allow me to reply.
I told you the numbers. You know the numbers. I would think that would concern you as Secretary.
You're implying that is because of a drop in vaccination rate. 80% of those numbers are people who are over 5. They have nothing to do with me. Vaccination rates dropped after COVID because of mismanagement.
I'll reclaim my time, Mr. Secretary. Thank you. And you replaced all 17 members with people who lack the expertise required to make evidence-based recommendations.
Wrong. Absolutely.
Well, it's true.
Completely, utterly wrong.
Okay. Let me turn to 2 other areas that I know you care about, I care about, mental health and addiction. As you know from our past conversations, substance use disorder and addiction, it's a health issue that is, I bet, matters to everybody in this room. It matters to me and my family. I have a son, Harry, 13 and a half years in long-term recovery from addiction to opioids. So many of my constituents have had this same struggle. So many of my constituents have lost family members to addiction and to overdose. I know you, too, have been open about your own recovery. Would you agree that addressing our nation's mental health and substance use crisis is a priority of yours?
Absolutely.
In your testimony, you state, quote, we must address the root causes of behavioral health conditions, end quote, and that HHS will focus on strengthening prevention. Secretary Kennedy, you stand by that testimony?
Yes.
Thank you. Did you recommend cutting $261 million from SAMHSA's Center for Substance Abuse Prevention, yes or no?
We didn't cut that money.
Have you read your budget? Have you read your budget proposal?
For this year?
For this year. And we could talk about SAMHSA before, but for this year, did you read your budget proposal?
I thought you were talking about another issue.
Okay. You've cut SAMHSA.
But we've also elsewhere increased.
SAMHSA. Am I right?
Dramatically,
You're cutting SAMHSA.
We've dramatically increased our investment in addiction elsewhere.
That is actually not true. That is seriously not true. And that's why we have to have these budget hearings and you have to come in knowing what your budget request was. I have read the budget and your testimony. You state in your testimony that AHA, I'm not sure that acronym, but AHA, will focus on high-impact priority areas, including mental health. Did you recommend cutting $1.3 billion from the Center for Mental Health? $1.3 billion cut in your budget.
I think that's the proposal.
Okay, you're comfortable with that. Your testimony cites White House MAHA report finding a shortage of behavioral health providers. Do you agree with that finding? Did you recommend cutting $68 million from behavioral health workforce development?
I think that's the proposal.
That's terrific. And you also propose consolidating substance use and mental health block grants along with state opioid response funding, just as we're finally making some progress. You did not increase the overall funding. You're trying to cut all of these things. In my neck of the appropriations woods, we call that kind of block granting shifting and shafting. We move all of you into one fund of money. We don't give you any more. In fact, we cut a whole lot, and good luck finding your resources.
Yeah, we've created new programs.
New programs, because the other ones were so lousy? SAMHSA was a bad program? I guess that's why you cut it earlier this year.
I'm happy to explain why, Congresswoman.
Well, let me just finish with, you cut it entirely earlier this year, sending 2,800, I think, notices of grant cancellations, which the administration had to reverse in a matter of a day. What kind of incompetent decision-making is that when lives are at risk?
Termination notices went out in SAMHSA, and I reversed them as soon as I found out about it, within 24 hours.
Yes, it was a crazed mistake.
What Madeleine Dean does in this exchange is something that often gets lost in political theater. She forces clarity where ambiguity has been allowed to linger. Instead of getting pulled into broad ideological arguments, she narrows the focus to measurable facts, timelines, and consequences. That's why the moment feels sharp. It's not just confrontation, it's structured accountability. When she asks Robert F. Kennedy Jr. a simple yes or no question about the MMR vaccine, she's not just asking for a medical opinion. She's drawing a line between public health consensus and political messaging. The significance of that moment goes beyond the hearing room. Vaccination policy isn't abstract. It directly shapes behavior at scale. When public officials hedge, qualify, or delay clear answers, it creates space for doubt, and in public health, doubt spreads faster than facts.